Hi, my name is David Corey. I'm the president of Apovia. Apovia is a pharmacy management company that specializes in owning and managing in-house clinic pharmacies. Apovia decided to host a panel discussion about COVID-19 vaccination programs entitled The 1-2 Jab at the recent 340B Coalition Winter Conference. Our distinguished panel included Dr. Janet Young, Dr. Yvette Bemadou, Dr. Mary Kelleher, and the Honorable Dr. David Schulber. Did the CDC COVID-19 vaccination provider agreement present any challenges?
Well, we struggled with some communication problems. It took us about a week's time of back and forth before we could even complete the form.
The enrollment form was quite long. They wanted a lot of data, so I was surprised.
The bureaucracy and sort of the paperwork is always the hard part, but the purpose of the agreement is really to get the commitment of the organization who's receiving the vaccine to timely report it.
How receptive was your medical staff to receiving one of these novel vaccines?
It's been a challenge, and it continues to be a challenge.
We're seeing around the country about a 60% vaccination rate. And I have to tell you, this is the thing that surprises me the most. I simply didn't expect it. I thought that we would see among healthcare professionals a much higher acceptance rate.
We had a group of physicians. Some had come from African countries where there was a historical distrust of new medical interventions, and they were raised to kind of know that things were, experimented on people of color, and that distrust was real. So we had to look at that and then have conversations about that history.
For right now, our infectious disease specialists are doing one-on-one discussions with the providers, because how are we going to be able to really reach our patients if the providers are not confident about this?
How did the COVID-19 vaccine rollout impact day-to-day clinical services for your patients?
One of the things that I think it's important to point out is vaccine did not come with staff to administer.
In the midst of COVID-19 vaccinations, we're still maintaining COVID-19 testing and flu clinics. Don't forget about the flu.
This is one of the most exhausting periods of time we have ever worked. It's not uncommon for huge numbers of staff to work 8-9 o'clock at night.
How concerned are you of the developing mutational variants of the COVID-19 virus?
It is something I worry about. I think we all as medical professionals worry about it. But what can we do about it right now? And what we can do about it right now is decrease community transmission as much as we can.
I think it's an opportunity to educate on why we have to put more effort into getting the brakes on viral replication.
Vaccine itself, I think we have pretty good confidence probably will cover the current variants that are out there because it's designed to create antibody to the entire protein spike.
Today we mark a truly grim, heartbreaking milestone. 500,071 dead.
I don't think we've ever had a health condition under such a microscope.
I think people have a sense that more time has passed than what has actually passed. Some patience is required and some persistence.
I have to confess, it's such an exciting challenge because so many folks are awake. So many nurses in Delaware want to come out of retirement to assist. It's been a great grassroots, volunteerism.
We were able to do a vaccine clinic on Saturday for which providers, including my physicians and nurse practitioners, volunteered.
We have 3 remarkably calm leaders in front of us today.
I have to give a shout out because I saw Sarah Lai's name show up on the panel. Sarah Lai is the Chief of Health Center Administration. She's a member of our epidemic management team.
I have to give a call out to my CEO because she understood the importance of meeting the call to vaccinate our community.
The pharmacies are, I think, a great adjunct to what we need to do, because that's going to allow access for those individuals who utilize pharmacies well.
And the poor state and the governor's office have done such a remarkable job with what they've been handed.
Given the fact that we started this pandemic and for the better part of the year really didn't have a national policy, this is really the beginning of it. The Biden administration is trying to do is to give some more advanced information so that people know what vaccine they're getting and when they're getting it so that they can plan appropriately. And it just takes a little bit of time to work all that out.